So in the last class we were discussing about blood pressure, pulse and other things. And here we will be studying what is a daily activity and what are the significance of ECG, cardiac fitness, stress, etc. So to begin with, we will go to the importance of daily physical activity. In the case of daily physical activity, here you can see that it encompass means includes all the movements performed during a regular day. We are walking, we may be sitting, we may be lying, and all these will be, for example, if you are walking, moving around in a classroom or moving around in a room, all these will need some amount of energy, and all this energy will be because if we have some mobile app and if we are walking, after some time it's so you had walked this much step and you have spent this much energy, so it will be showing how much energy you have utilized for every activity. So all these activities will be coming under the daily physical activity. So generally speaking, we have three different types of activities. One is occupational activity, for example, tasks performed as a part of one's job. For example, right now I am standing, otherwise I will be sitting. So it is a part that we are doing as a part of our job, such as walking or lifting some object or standing, or say all these are part of your activity, and these are known as occupational activities. Anjana, please keep quiet. Then other activities are household activities. Household activities means cleaning, cooking, gardening. So for example, daily every housewife will be spending a lot of time. Most of the time she will be standing, or sometimes in every activity lot of energy is being spent. So whether it is cleaning, cooking, gardening, or doing folding or washing clothes, all these will be taking a lot of energy. So these are known as household activities. Household activities are also an important form of spending energy. Then leisure activities like recreational pursuits like walking, jogging, swimming and cycling, all these are done as a part of leisure activities or normally sports activities. So what are the benefits of this daily physical activities? Coming to daily physical activities, here you can see one is it is improving your cardiovascular. For example, every day you are walking some time. For example, half an hour of walking, daily walking 2 to 3 kilometers every day is good for your health. So that is improving your cardiovascular activity, and it is also making your muscle fit. For example, sometimes if you are walking every day for 2 to 3 kilometers, that will be preventing leg pain and other kinds of leg pain, back pain and other types of pain. So that is an advantage. Then it makes you enhance your mood, because if you have some kind of trouble, just go out and walk for some time, and spending time in nature is always very good. So that will refresh your mind, so it will improve your mood, and instead of fighting with the members in your family, you are going out, so they will be also refreshed after you are coming back. So then it maintains a healthy weight and also supports the metabolic health. So when you are walking, when you are involved in physical activity, it is keeping your weight. Then reduce the risk of chronic diseases such as diabetes and hypertension. So diabetes is another big problem. Because India is considered to be the diabetic capital of the world, because most of our food mainly consists of rice. Eating too much rice is always a problem as far as diabetic is concerned. So so nowadays in many families, night time it is mostly wheat or chapati based food. So if we are eating chapati at night, it is always good. Otherwise, after a period of 40, you have to make sure that instead of rice, if you are eating rice twice a day, then you are surely taking ticket to diabetes. So diabetes is a major problem for families in Kerala. Then hypertension is increased blood pressure. Experts recommended that at least 150 minutes of moderate intensity aerobic physical activity should be, that is 150 minutes means in every day you should spend at least 20 minutes or 25 minutes for walking or some kind of activity you should do. So if you are doing that, your body will be healthy, remain healthy, your heart will be okay, your muscles will be okay. So that is the advantage of spending some time for daily physical activity. Now another aspect is the electrocardiogram. Already you may be having an idea what is an electrocardiogram. It is a medical test that records the electrical activity of the heart over a period of time, and it is used to diagnose and monitor heart condition. Sometimes ECG is basically recording how the heart is working in terms of its electrical activity. Now in an electrical activity, you can see that in an ECG you can see that there are different type of, here I will show you an ECG. See this is how the ECG is normally. See, this is how normally an ECG will be appearing. See, there is a P wave, there is a QRS wave, and there is a T wave, and there is a U wave. And normally this P wave will be referring to atrial depolarization. That is, when your atrial chamber or auricles are contracting, heart will be producing P wave. When your ventricles are contracting, heart will be producing QRS wave. When ventricles are relaxing, heart will be showing the T wave. So this is how the normally heart will be, the ECG will be appearing. So by looking at this, looking at the height of this P wave, for example, in a person there is no P wave, but QRS waves are okay. That means auricles are not contracting properly. Now if you can also see the P wave PR interval, that is this P wave takes a longer time. That means the contraction of the auricle is taking place in a very slow manner. So that is also a problem. So by simply studying this time interval, this QT interval, PR interval, doctors can predict whether the heart is working properly or whether there is any slowness in the working of the heart. All these will be indications of heart malfunction. So that is how we can use this P wave, QRS complex, and T waves are there. Now what are the uses? The arrhythmia, the rhythm of the heart, that is the beating of the heart is not proper. The chance of heart attack, coronary artery diseases. Any coronary artery, you know that the artery which is supplying blood to the heart is known as a coronary artery. If there is some kind of block in that artery, that will lead to heart failure. Then it also monitor the health during and after the treatment. Sometimes a person with blood pressure or other kinds of complication, they may have this kind of problem. Then access the functioning of the pacemaker. Sometimes pacemaker may be kept inside the body of many people. If the doctors will be regularly assessing whether the pacemaker is working properly. So so how these ECGs are normally done, you can see that electrodes are placed on the chest, arms and legs. Yeah, I will show you a picture of that also. Here you can see that this is how the normally the ECG are conducted. You can see that. So here there is a picture showing how the ECGs are conducted. So on the chest and legs, arms, etc., they will be placing electrodes. This kind of electrodes they will be placing, and they are very sensitive, and they will be able to record fine electricity coming, and that will be amplified using an amplifier like device, and that will be finally converted into a computer reading. Here you can see that, and this computer graph is what is actually given as an output, whether it is ECG or electroencephalogram. It is a record of this electrical activity. So finally we will be getting a graph like this, and that graph will be showing what are the variations in our electrical activity, and based on that doctors will be able to predict whether heart is working properly. So that is about the ECG. Now next is the cardiac fitness. Coming to the cardiac fitness or cardiovascular fitness refers to ability of the heart, lungs and blood vessel to supply oxygen rich blood to muscle during an activity. So there, for example, you are walking very fast. Sometimes at your age you can walk very fast, you can run very fast. But for a person above 40, if he or she is walking very fast or running very fast, after some time they may feel gasping, they may feel very tired. They feel that their body is not giving them enough blood or enough oxygen, and that is known as a cardiac fitness. So it is the ability of the heart and as well as your lungs to give oxygen rich blood to different organ. If your heart, you are running, your body mind is okay and you are running, but your heart is not pumping you sufficient blood, then you feel a deficiency of oxygen in your muscle, and that will be that is known as a reduced cardiac fitness. So only if your lungs as well as your heart are working faster and giving you enough oxygen rich blood, your body muscles will be performing normally. So that is known as a cardiac fitness. Here there are number of things. VO2 max, that gives maximum amount of oxygen body can use during an intense exercise. So by measuring VO2 max, we can say how active, how healthy your body is. So that is an indication. Then heart rate recovery, how quickly heart rate returns to normal post an exercise. That is, you are having an intense you are running in the ground for some time, or you are playing cricket or football, then that time your heartbeat will be very fast. Then after a period of time you start resting. Then how much time, whether you take 30 minutes or you take 1 hour to come back to the normal state, that is known as heart rate recovery. So how quickly heart returns to normal post an exercise. After doing a heavy exercise, how much time you are taking to come back to the normal state. That is also a indication of your heart health, the health of your heart. If you are taking longer time, that means the heart is not so much okay. Then what are the benefits of cardiac fitness? It strengthens the heart muscle. Then reduce the resting rate and blood pressure. When your heart is okay, when you have good cardiac fitness, your blood pressure will be okay. Then enhance the endurance and energy level. That is also another advantage of healthy heart. So what can we do to improve the cardiac fitness? One is aerobic exercise. Aerobic means oxygen consuming exercise, are known as aerobic exercise, like running, swimming or cycling. So all these are high energy exercises. Running, swimming or cycling means a lot of energy. Then interval training to alternate between high and low intensity activity. Sometimes you are running for some time, then you take a small rest. Then after a period of then you are again doing some high intensity activity. So that kind of training are known as interval training. Then another aspect is that maintain a balanced diet rich in heart healthy nutrients. So there are a lot of nutrients are there. I will show you. For example, if you are taking this badam, we will see what are the if you are taking badam is a almond. See, they are rich in nutrients, and this kind of seeds are always good for your heart, because it is good for example, it contains high amount of HDL cholesterol. It reduces the risk of heart disease, supports the weight management. So people, especially people living in colder countries like Kashmir or to other, they eat a lot of this almond. And because almond that is good for heart and also good for weight management, and it also improves the blood sugar level. It improves brain health, skin health, because they are living in a colder age. So because the action of cold or lower temperature, skin becomes quite dry. So when people are eating this almond, they contain a lot of vitamin E. It keeps their skin smooth. So if you go to a colder country, you may feel that the skin is maintaining the health of your skin may be a major concern for you. So eating these kind of things can improve the nature of the skin, as well as keep your heart and other bone healthy. So these are some of the advantages of heart healthy nutrients. Then stress. Another aspect of another health parameter is the stress. What is stress? if there is an examination for you tomorrow, you may feel stress. Some may not feel any stress because you have not studied. Whether you study today or not today, somebody will be having, they know what will be the result. Those people may not have any stress. So stress is body's response to challenging or threatening situation. If somebody is asking you to make a speech tomorrow, then there will be stress. So such kind of situations are normally creating the stress. So it is normally the body's response. If somebody is coming to attack you, somebody is shouting at you, then you will have a stress. So it is body's response to challenging, threatening situation, activating a fight or flight reaction. There is a fight or flight. So when we have a stress, when we have a threatening situation, somebody is shouting at you, or they are physically going to assault you, attack you, you have only two options. Either fight with that person or run away from that person. That is known as a flight, escaping reaction. If in both cases you are actually maintaining you are improving your survival. If you are fighting with that person, you must be sure that you have a chance of winning. If you are absolutely sure that that person will finish you, the best survival strategy is to run away. So that is known as a fight or flight. So types of stress, one is acute stress, then there is chronic stress. Acute stress means short-term stress caused by immediate challenges like an accident. That will immediately put you in acute stress, or a danger. An approaching danger can give you a very high intensity stress, that is known as acute stress. Some people may not have the capacity of managing such acute stress. So then chronic stress. Chronic stress means long-term stress that persists over an extended period. For example, in family, sometimes there will be difficulty. Sometimes there will be work-related stress. These are all chronic stress. But this chronic stress can also affect you over a period of time if you don't know how to manage your chronic stress. For example, you are working in an office where your boss or superior is a very difficult person to manage. Every day you are meeting him and you have no option to work there, because if you go to another job, you may have reduced salary or no job. Then you will be working in the that same office, but still you will be having tension. And that kind of situation is known as a chronic stress. But chronic stress can, over a period of time, can affect you mentally and physically. It makes you more older. It makes you look less young. Then what are the effects of stress? It raises cortisol level. There is a cortisol, it's an hormone. So when you have a stress, there is a chance of high blood pressure and reduced immunity. So that is one important problem of this stress. So if you don't know how to keep your body stress free, you are actually inviting lot of disease, lot of trouble for your body. So this is very important. That is why from our traditional time onwards, people are practicing yoga and other types of exercise, because that all will be reducing your stress. If we know how to be stress free, that is a one important quality that makes you live longer and healthy. Living longer is always good, but if you are living longer without health, then that is not good. So it can affect your mental health, causing anxiety and depression. So if you feel that you are having a lot of stress, different types of stress are there. For example, medical stress due to medical situation. You have an illness, or your family member have an illness, that will give you stress. You don't have sufficient money, that will give you stress. Your neighborhood is against you, that will give you a social stress. So different type of stresses are there, and you should be able to manage this stress properly. Then it can disrupt sleep, digestion. So for example, you feel that you are stressed all the time, you cannot sleep properly. Lack of sleep can also affect the quality of life next day. So these are the problems associated with stress. Stress can make you sleepless. It can affect your digestion, and and it may, for if you are stressed you cannot study properly. That's everybody's experience. Then what are the management techniques for stress? Regular physical activity and relaxation exercise, yoga, meditation. So stress is a part of our everyday life. And one important quality everybody as students you should develop is that how to manage your stress. If you know how to manage your stress, because right now you have very few stress. Only stress is studying. Studying is a major stress for you. But if you don't know how to manage this stress properly, what happens is that later in your life you may not be able to manage your other life related stress like marital stress, family stress, parental stress, medical stress, economical stress. Different types of stresses are there. So learn how to manage your stress at this time. What we can do, where physical activities will help you. For example, if you are stressed, then what you can do, engage in some kind of activity, at least go for a walk. Then healthy diet and adequate sleep. That is why I always say that sleep 7 hours daily. Compulsorily you sleep 7 hours. If you reduce that 7-hour limit, surely you will have some kind of disease later. Then seeking social support or professional counseling when needed. Some people need a lot of friends, and because some people may not need too many friends. So if you know how to manage with the friends, that's good. If you don't have friends, learn how you can manage even without friends. So these kind of things are important. Then hematological parameters. Hematological means blood related. Hematological parameters include components of the blood that are analyzed to assess the health status. For example, when you go to a doctor, what doctors are normally doing? They will ask you to take a hematological assessment. Hematological assessment normally will be checking your RBC level, how many RBC are there. Then if RBC levels are low, that means you have an anemia. And another thing they are checking is WBC. There are different types of WBC. There are eosinophil, lymphocyte, etc. If there is a high lymphocyte number, that means your body has some virus, your body is fighting an infection. Similarly, if you are high ESR, normally the doctors will eosinophilia. So if there is high ESR, that also shows that you have some kind of infection, maybe worm related infection. Sometimes cough can also be caused by high ESR. Then platelets, for example dengue fever, the platelets count will come down. So these are all signs that your body is not working, some kind of infection are there. Then abnormal level lead to bleeding disorders. Then hemoglobin, a protein in the RBC that can bind oxygen. If there is a deficiency of hemoglobin, your oxygen carrying capacity of your blood will be reduced. That means you may not be able to engage in high intensity work. Then essential hematocrit, the ratio RBC volume to total blood volume, indicates hydration levels or anemia. That is how much amount of water is there in your body. So regular blood tests will be always helpful in diagnosing infections, nutritional deficiency or blood related disorders. So it is important that after an age of 40, you should conduct normal every year, at least once in a year you should conduct some kind of test like that. So that is nowadays they are called what kind of there is a term for that, body checkup. I am not going to get. So that kind of body checkup will help you to find out whether you have any kind of problem. Then finally, it is the body mass index, about which we have already discussed. It is based on the height of the person as well as weight of the person, and it is based on that we have different type of people. One is underweight people, normal weight people, overweight people, obesity. So if your weight BMI is below 18.5, then you are underweight. And if your BMI is between 18.5 and 24.9, then you are in a normal range. If it is above 25, then we call it by the name overweight. Then there is obesity. So based on that, so always have an assessment of there are different BMI calculator, body mass calculators are there. If you can go to the BMI, see just type BMI calculator, you will get a lot of BMI calculator for online. See, it is very simple way of discovering. For example, the person is having a male person and his height is 180 and his weight is 75. We will calculate what is his BMI. The BMI is 23.1. So, for example, if his weight is 80, we will see that normally it will be 175. So you can see what is the BMI. You can again see the BMI is in the 26 range. That is slightly towards the overweight. So what if you feel that your BMI is in this range? What you can do? You cannot increase your height. It is impossible to increase your height. It is impossible to decrease your height. So what is the only thing you can do? You can reduce your height. Then this way you can see the BMI. If you are reducing to 78. BMI is still in the normal range, that may be okay. And if you reduce by still 1 more kg, you will come to the normal BMI range. So why an ideal weight for such a person is 75. That is why I always say that if your height is 175, your weight of 75 is okay. And we will check another person. The person is 165 and she is a female and her weight is 70. We will see what is the BMI. See, the BMI is 25.7. So for such a woman, if she is coming to 65, her weight height is 165 centimeter, then 65 kg is okay. And up to 68 maybe I think she will work okay. She will be okay. Okay. So if your height is 165, you can have a maximum weight of 68. And if your weight is increasing above 68, you are going to overweight. Overweight means all kinds of problem. Back pain will be there, blood pressure will be there, cholesterol will be there, heart related problems will be there, diabetes will be there. So when one disease comes, along with one disease, another 2-3 diseases will come freely. So that is the importance of regular checking of BMI. So this way you will have an idea of what is your ideal weight and what you should do. So limitations of body mass index does not count the muscle mass, bone density or fat distribution. That still may not be a suitable measure for athletes or elderly. So that is the problem with the BMI. There are some important, but for a normal person BMI works fine. Importance of BMI helps assess the risk condition like cardiovascular disease, diabetes or metabolic disorder. Then so this way it gives you an awareness about healthy weight management. So by doing a regular BMI checking, you know where you are standing, and you can also take some precautionary measures by which you will be able to reduce your body mass index. So this way, these are the different ideas regarding what are the main health parameters. Around 11 of them we have studied. So sometimes they can ask you essay question based on that.